You wake up in the morning and the first thing you notice is that your mouth feels like sandpaper. Your throat feels tight. You immediately reach for a glass of water and take a long drink, and for a moment you feel better. But then you wake up the same way tomorrow, and the day after that. Most people think this is just normal. They think it is just something that happens when you get older or when you have not been drinking enough water. But here is the truth that almost nobody talks about. That dry mouth is not random. It is not just something to ignore. Your body is actually sending you a message. And in the next few minutes, you are going to learn exactly what that message is and why it matters so much more than you might think. This is something that affects millions of people, especially as we get older. You probably know at least a few people who complain about waking up with a dry mouth. Maybe you have been dealing with it for months or even years. The thing is, most of us just accept it as a normal part of life. We assume it is just dehydration. We think we will drink more water and the problem will go away. But what if I told you that persistent dry mouth is often not just about drinking more fluids? What if it is actually a window into deeper health patterns that you need to understand? The reason this matters is that your body is constantly sending signals. When you learn to recognize those signals and understand what they mean, you can take action before small problems become bigger ones. You deserve to understand what your body is trying to tell you. So let us start with the basics. What exactly is dry mouth? The medical term is xerostomia, which basically means that your saliva production has decreased. Now you might be thinking, okay, it is just saliva. It is not a big deal. But here is where most people get it wrong. Saliva does so much more than just keep your mouth moist. It is one of your body's most important protective barriers. Saliva protects your teeth from decay. It helps your digestive system work properly because it contains enzymes that break down food right from the moment it enters your mouth. It fights bacteria and infection. It keeps your mouth comfortable. It helps you swallow. When saliva production decreases, your whole mouth environment changes. Your mouth becomes more vulnerable to cavities and infections. Your digestion actually becomes less efficient. Your comfort level drops. This is why persistent dry mouth is not something to just brush off and ignore. Now, you might be wondering why this happens specifically when you are sleeping. During the night, your body shifts into a different mode. Saliva production naturally decreases because your body is in a resting state. You are swallowing less often because you are not eating or talking. Your salivary glands are less active. But there is something else that happens too. Many people breathe through their mouth while they sleep, especially as they get older or if they have certain breathing issues. When you breathe through your mouth instead of your nose, saliva evaporates much faster. Your mouth dries out more rapidly. Lying flat can also affect circulation to your salivary glands. So when you wake up, your mouth feels parched. Now, some dryness in the morning is actually normal. That is a natural part of sleep. But if you are waking up with severe dryness, or if it is happening every single day and it takes a long time for your mouth to feel normal again, that is when your body is sending you a stronger signal. That is when you need to pay attention. So what are the actual causes behind persistent morning dry mouth? There are several, and I want to walk you through each one because one of these is probably responsible for what you are experiencing. The first major cause is medication side effects. Many common medications list dry mouth as a side effect. This includes antihistamines that you might take for allergies, blood pressure medications, certain antidepressants, and many other drugs. If you are taking multiple medications, the effect can be even stronger. The second cause is sleep apnea. This is actually more common than many people realize. Sleep apnea means your breathing stops and starts repeatedly during sleep. This forces your body to compensate by breathing harder through your mouth. This dramatically increases mouth breathing, and mouth breathing is one of the fastest ways to dry out your mouth. If you have sleep apnea, you will often wake up with severe dry mouth, and you might notice other symptoms too, like feeling exhausted during the day or waking up gasping for air. The third cause is diabetes or prediabetes. High blood sugar levels actually affect saliva production. Your body does not produce saliva the way it should. Additionally, diabetes often comes with increased thirst because your body is trying to compensate for high blood sugar. The fourth cause is simple dehydration. You might just not be drinking enough water throughout the day. Many people focus on drinking water only at night, but what actually matters is consistent hydration during your waking hours. If you are dehydrated, your body will not produce as much saliva, and morning dry mouth is one of the first signs. The fifth cause is mouth breathing habits. Some people are chronic mouth breathers, whether during sleep or while awake. They might have a nasal obstruction, or they might have just developed the habit over time. Mouth breathing dries out your mouth significantly more than nasal breathing does. Beyond these 5, there are other causes worth knowing about. Autoimmune conditions like Sjogren's syndrome can severely reduce saliva production. This is less common, but it is important to mention. Age-related changes are real too. As we get older, our salivary glands naturally produce a bit less saliva. But this does not mean you have to accept severe dry mouth as an inevitable part of aging. Stress and anxiety can also reduce saliva production because elevated stress hormones affect how your glands function. Even certain lifestyle factors like smoking or using certain oral products can contribute to dry mouth. The key is figuring out which of these is actually happening in your case so you can address the root cause. Now let us talk about what you can actually do about this starting today. The first thing is to focus on your hydration strategy. You want to drink water consistently throughout the day, not just when you are thirsty or only at night. Think of it like this. Your body needs consistent hydration during your waking hours so that your salivary glands have enough water to produce saliva. Drinking a lot of water right before bed does not help as much as people think because your body is not actively using that water while you sleep. Instead, aim to drink water steadily from morning through evening. The second habit is to develop breathing awareness. Start noticing whether you are a mouth breather. If you are, try practicing nasal breathing exercises. Close your mouth and breathe through your nose. This takes practice, but it makes a real difference. You can even practice nasal breathing during the day and try to be conscious of it when you are falling asleep at night. The third practical habit is to use a humidifier in your bedroom, especially at night. Adding moisture to the air around you reduces how much saliva evaporates from your mouth while you sleep. A simple humidifier can make a noticeable difference within a few days. The fourth habit is to be more careful with your oral care products. Use a gentle, alcohol-free mouthwash. Many mouthwashes actually contain alcohol, which dries your mouth out even more. Skip those and go for alcohol-free options. The fifth habit is to consider using saliva stimulants. Sugar-free gum or sugar-free lozenges can help trigger your body to produce more saliva. Chewing gum during the day can be surprisingly effective because the action of chewing stimulates your salivary glands. The sixth habit relates to your medications. If your doctor has told you that dry mouth is a side effect of one of your medications, talk to them about the timing of those doses. Sometimes taking medication at a different time of day can reduce dry mouth. Do not stop taking your medication without talking to your doctor, but do ask whether adjusting the timing might help. The seventh habit is to pay attention to your sleep position. If you sleep on your back, you are more likely to mouth breathe. Sleeping on your side can reduce mouth breathing and help keep your mouth more moist. The eighth habit is to limit drying foods and drinks. Caffeine and alcohol can worsen dehydration. They pull water from your body, which means less water is available for saliva production. The ninth habit is to check in with yourself regularly. Track when the dryness is worst. Is it every morning? Only certain mornings? This information helps you identify patterns and figure out what is actually causing your dry mouth. Now, there is something most people get wrong about dry mouth, and I want to address these common mistakes so you do not waste time going down the wrong path. The first mistake is only drinking water at night. People think that if they drink a big glass of water before bed, they will solve their dry mouth problem. But this does not address daytime dehydration. Your mouth dries out at night partly because you have not been drinking enough water throughout the day. The second mistake is using alcohol-based mouthwash. Many people think that using mouthwash is healthy, and it can be, but alcohol-based products actually dry your mouth out further. Switch to alcohol-free alternatives. The third mistake is ignoring persistent dry mouth and hoping it goes away on its own. If you ignore it, you are at risk for tooth decay and infections because your protective saliva layer is compromised. This is something worth addressing. The fourth mistake is assuming that dry mouth is just a normal part of aging. Yes, our salivary glands do change as we get older, but severe or persistently worsening dry mouth is not something you have to accept. It deserves investigation. The fifth mistake is self-diagnosing based on one symptom. Dry mouth has multiple causes. If you decide that you definitely have diabetes or definitely have sleep apnea just because of dry mouth, you might be heading in the wrong direction. Instead, consider all the possible causes and look for other signs that might point to the actual issue. The sixth mistake is reaching for sugary drinks to solve the problem. Sugary drinks do provide hydration, but they also create other problems. They feed harmful bacteria in your mouth. They contribute to cavities. They spike your blood sugar. If you are going to drink something, water is by far your best option. If you want some flavor, add a slice of lemon or lime to your water. Let me clear up some common myths about dry mouth because you have probably heard some of these before, and I want to give you the actual facts. The first myth is that dry mouth just means you need more water. The fact is that research shows persistent, dry mouth often signals underlying causes. Hydration alone may not solve it. If simple increased water intake does not fix the problem after a few weeks, something else is probably going on. The second myth is that everyone gets dry mouth at your age, so it is normal. The fact is that age-related changes do happen, but severe or worsening dry mouth should be evaluated. Normal aging does not mean you have to accept significant dry mouth. The third myth is that if you had a serious problem, you would have other symptoms too. The fact is that dry mouth can sometimes be the earliest or most noticeable sign of conditions, like diabetes or sleep apnea. You might not have obvious other symptoms yet, but that does not mean something is not happening. The fourth myth is that once you treat dry mouth, it goes away permanently. The fact is that managing dry mouth is often an ongoing process. The goal is controlling the underlying cause and managing the symptom long-term. The fifth myth is that dry mouth only affects your mouth. The fact is that persistent dry mouth can impact your digestion, your tooth health, your comfort, and your quality of life. It affects more than just your mouth. So let me bring this all together with the most important takeaways that you should remember. First, morning dry mouth is not always just normal. It is worth investigating. Do not assume it is just aging or just dehydration. Second, common causes include medication side effects, sleep apnea, dehydration, diabetes or prediabetes, and mouth breathing habits. Third, most cases of dry mouth can be improved with practical daily habits. You do not necessarily need medication or expensive treatments. Small changes often make a real difference. Fourth, if your dry mouth persists despite making these habit changes and increasing your hydration, it is time to consult with a healthcare provider. They can help identify what is actually causing your dry mouth. Fifth, your body's signals matter. When you learn to listen to them, you are taking an active role in your own health. Sixth, small changes today can prevent bigger problems tomorrow. This is preventative health awareness, and it matters tremendously for healthy aging. Before you go, I want to leave you with something important. Your body is always communicating with you. Dry mouth is one signal among many. The fact that you watched this video and learned about what your body might be telling you means that you are already paying attention to your health in a way that many people do not. That matters more than you might think. Making small changes today, even if it is just adding a humidifier to your bedroom or practicing nasal breathing, shows that you care about yourself. Taking action on these signals is one of the most powerful things you can do for your long-term health. You are not alone in experiencing dry mouth. Millions of people deal with this, but most of them do not take the time to understand what it means or what they can do about it. You are doing something different. You are learning. You are going to take action. That puts you ahead. If you found this information helpful, please subscribe to this channel so you do not miss our next deep dive into what your body's signals mean. We create videos like this regularly to help you understand the subtle messages your body is sending. We also have a comprehensive video about sleep apnea and how it connects to dry mouth. The connection might surprise you, and I will link that below so you can watch it next. I would also love to hear from you. Have you dealt with morning dry mouth? Drop a comment and let me know what has helped you. Your experience might be exactly what someone else needs to hear, and your comment helps other people find the solution they are looking for. Thank you so much for watching. Take care of yourself. Your body is trying to tell you something, and now you know how to listen.